Okay, so this is tough to explain, okay? And I'm gonna try to do my best. So not necessarily. Just because you remember the tube in your mouth does not mean that the anesthetic was done poorly or that they woke you up at the wrong time. In fact, technically speaking, especially per the books, the safest time to pull the tube is actually when you can open your eyes on command, raise your head off of the table, at least for like 5 to 10 seconds, or squeeze one of our hands on command. Oftentimes that's not super pleasant, so we honestly try to do it at a different time, but it still has to be safe, and I'm going to talk to you guys about that in a different video, because there's stages of anesthesia that is not safe for us to pull the tube because you're at risk for like bronchospasm, laryngospasm, all these things. So we have to only pull the tube at a specific time and according to certain criteria that you meet. The majority of the people that we pull the ET tube on, meaning we extubate, who are what we refer to as awake, but you honestly just don't remember because most of the drugs that we use during your surgery cause either amnesia or you're still not fully awake in terms of what you think of as awake. So you hit the recovery room. But most of you and a lot of you are talking or conversing or smiling and answering questions once before we've even moved you off to the operating room table. The Versed medication that we give to most patients can cause forgetfulness, aka a little bit of retrograde amnesia. So a lot of you are like, I don't even remember going back to the operating room and moving over to the table. And it's like, well, you did. It was just the medication made you forget because of how it affects your brain. So depending on the surgery dictates basically how we wake you up. Whether we wake you up deep, meaning like you're still got a lot of gas on board and anesthetic, or we wake you up light, like fully awake. And all that depends on the type of surgery that you have and honestly the technique that your personal anesthesia provider likes to use. If you've had a big giant abdominal surgery with a huge incision like 12 inches long, then why does it always feel weird to say inches of something? Anyways, I don't want you coughing a ton when you wake up. For instance, like if you had a big intestinal surgery, okay, and they were all up in your belly, we cut through all the muscles and all the layers of fascia in your belly, then I need to have what's called a smooth extubation, smooth emergence from anesthesia. That's where the technique comes into play. That's where you can kind of determine the level of skill your anesthesia provider has, but you won't remember, but your operating room staff could. Obviously, some things we can't help prevent patients coughing when they wake up, especially if you're a smoker. No matter what I do, I gotta wake you up, and so you may cough no matter what. But there's things I can do to help you wake up a little bit smoother, per se.